Medical professionals of Reddit, what was a time where a patient ignored you and almost died because of it? Hello and welcome to Robots Reading Reddit. In this video we'll learn why you should always listen to your doctor. If injuries and stories of trauma makes you uncomfortable, you might want to sit this one out. We had a college student come into the ER and had a wonderful case of appendicitis. He needed to get surgery as soon as possible, as surgery is way easier and safer if done before it ruptures. He called his parents to let them know, and they told him to refuse surgery because he had a test upcoming in the week and they didn't want him to miss it. He left the ER against medical advice while we were all telling him that if your appendicitis gets worse and ruptures, it can definitely lead to death. The kid luckily comes back about 10 hours later after it ruptured. He gets the emergency surgery and the amount of time he got to spend in the hospital probably doubled. Patient came to see me having a stroke due to a blocked brain artery. I'd activated the code stroke team. Everyone was ready in the theater to get the clot out of her artery. Nurses, anesthetist, technician, but she, 42, insisted on updating her Facebook status and checking in before allowing me to treat her. Wasted 3 to 5 minutes and 6 to 10 million brain cells, if she had that many to start with. Patient was supposed to have staffed for 8 hours for her morning scheduled breast surgery. During the procedure she regurgitated what can only be described as a full partially digested English breakfast with identifiable sausages, egg, beans and possibly black pudding up into her unprotected airway and attempted to inhale the lot. Managed to prevent the majority of it going down, but she needed HDU care for a day or so for her lungs to recover from the stomach acid. It happened so often it was almost a non-issue. We would basically just shrug our shoulders and say welp. I had a patient who kept adjusting her insulin dosage against my advice because she was terrified of having her feet amputated like her mom. So she had several occasions of dangerously low blood sugar, one of which put her in the ICU. Had a lady who had the opposite problem, raging diabetes but in deep denial, so she would never take her insulin. So she was in the ICU multiple times for the diabetic ketoacidosis. Had a ton of patients on dialysis who skipped dialysis for whatever reason. Didn't feel like going. Had a fight with boyfriend, who was her ride. Took a vacation to a city without a dialysis unit, etc. So they would come in with their electrolytes all messed up and had to get emergency dialysis inpatient. Had a billion old fat men with chest pain for weeks refuse to come into the hospital to be evaluated for cardiovascular issues and either die at home or come back a week later with extensive MEs. Half of my patients with COPD were still active smokers despite my exhortations. One had burn scars over a third of his body from the last time he smoked around his O2 tank. Had patients take extra doses of benzodiazepines, Xanax, Valium, etc. and end up in the hospital with overdoses. Like many others have stated, this happens so regularly that it's almost hard to think of a specific instance. However, I do have one. It's not about a patient, but it's about a patient's family member. I had a patient in the ICU for some respiratory issue I can't even really remember now. He had chronic pain and some mental health issues at baseline, and he had this codependent girlfriend who was a very nice lady, but who was very present at his bedside all the time, constantly beside herself with worry that he wasn't getting enough pain medication. He was, and that he wasn't getting enough sleep. He wasn't, but nobody does in the ICU. We kept reassuring her that we were giving him his meds and not to worry. The day he transferred out of the ICU I was working a night shift and heard a code blue paged overhead. It was for him. He had gone into respiratory arrest, was fortunately found right away, intubated, resuscitated, and came right back to my ICU. After some digging, and after he was able to wake up and give us some info, we found out that his girlfriend was worried he wasn't going to be able to sleep, so she bought some Seroquel on the street and gave it to him. And his dumbass took it. He was already on his home dose of Seroquel and opioids, plus some additional opioids for the acute pain of whatever was going on with him. The sedation from that extra Seroquel in conjunction with the rest of his meds tipped his already not so great respiratory issues into a full arrest. Once he woke up, he was mortified and asked that she not be allowed to visit him anymore. I had to call her and tell her she was not allowed to visit him anymore and that hospital security had been alerted. She was not happy. The lesson: if someone is hospitalized, we will provide the appropriate medications. You do not need to bring in extra meds you bought on the street. We got it. Patient came in and was discovered to have an abdominal bleed. Doctor was in middle of surgery and patient's vitals are good, so we monitor and tell patient she will go up as soon as doctor is finished. 2 hours later, OR sends for patient and she refuses. States if doctor can make her wait, he can wait. She wants dinner and to go to bed. Nothing worked to change her mind. After several rounds of doctors and nurses educating / begging etc., surgeon comes down to see what is going on. After speaking with her for a while, he comes out of the room and says to keep monitoring and don't feed. She'll come one way or another. Several hours later, I'm taking a set of vitals and talking with patient when she just flatlines in the middle of a sentence. Luckily, she came back right away. Immediately after she felt a little better, patient apologizes profusely and signs consent. Rushed to OR. There was a lot more stubbornness and cursing on part of the patient, but wanted to keep shorter. Just boggled my mind that she almost died out of spite. Had a throat cancer patient. We offered him surgery to remove the tumor. It was a fairly conservative surgery. He left because he didn't want a mutilating surgery and his daughter-in-law had been studying magnet therapy and she was quite good with it. His words: he came back a year later and was out of reach from any treatment. His cancer was so advanced that there was nothing we could do for him. Had a repeat patient, not quite frequent flyer status. As a medic, that would always call for a severe allergic reaction to shellfish every other month or so. She had always had the allergy and knew her reactions were getting worse. After a year, 6 or 7 calls of this silliness, my crew and I stayed in the hospital with her and talked at length about the situation, since she'd always stay mum about how it kept happening. She told us she comes from a patriarchal culture and her father made this amazing seafood soup. If she didn't eat it and force her body not to reject his gift to the family, she would lose her car, phone, or whatever punishment her father deemed necessary. We pleaded with her to do whatever it took to show him it was deadly and carry her EpiPens with her. Fast forward a few years, when I altered course into nursing and joined that saw a familiar bloated face. Turns out she had gone off to college in another state and hadn't been home for a while, but had visited her folks for a holiday. Of course she had the soup, and despite hitting herself with the EpiPen when her throat started tightening, the reaction continued. Her mom, who I had never seen before, told me she tried to eat it fast and rushed to the bathroom, where she was found on the floor. Medics couldn't tube her in the field, so tried medical management until they could drive her to our ER. Doc performed a tracheotomy at the bedside and she went to the ICU. Took a week for her to recover, and I was told by the ICU nurses that her father finally got it, that her allergy was a real medical condition. I've seen a lot of heart failure patients as a student. These people have problems with swelling and are often told to follow low sodium, low fluid diets and need to be taking diuretics. People often call them water pills. There's always a handful that never follow these instructions and don't take their medications, and they need to be admitted every few weeks / months. They have liters, yes multiple liters, of fluid diuresed, peeing out of them. This one super obese woman, BMI 50, had like 40 liters taken off of her in a couple weeks. I don't know how she could breathe. Imagine having so much fluid stuck in your legs you could probably fill up a kiddie pool. As mentioned a lot in this thread, a lot of this is facilitated by their own lifestyle and non-compliance. It's incredibly frustrating. When I was in medical school, I had a gentleman in his late 60s come in for chest pain. Found to have a large heart attack. Very impressive STEMI in lab by EKG. Refused emergent cardiac catheterization. Go through the arteries and put a stent to open up the vessel of the heart so he could bring his car home, and planned on taking an ambulance back to the hospital. He was in the parking ramp and it cost $20 a day to park. Came back by ambulance in full arrest, no pulse, and died. Doc had to call his son and explain what happened. He was like, "Yeah, that sounds like dad. He's always been cheap." Not a med professional, but my aunt is, and I'd like to share her horrifying story. She once had a patient, young guy in his early 20s, who had very poor hygiene. Didn't shower regularly, didn't brush his teeth, wore the same clothes for days on end, etc. He one day came in with a nasty rash on his lower abdomen/pubic area that was starting to show signs of infection. She provided antibiotics and instruction and extensively stressed to him to improve hygiene and keep the area clean, otherwise it'll just keep coming back or get worse. Well, as the story goes, he didn't pick up the prescription and apparently chose to just keep putting R&D gold ointment on the area. She later found out he ended up in the ER after going into shock at work. Turns out he ended up getting gangrene in the area, and it had spread to his penis and scrotum, which had to be removed. Alright, pack it up. We are done here.